Welcome to our June Town Hall meeting. I'm Jesse Tucker, the President and CEO of Wayne UNC Healthcare, and I'd like to welcome you to our Town Hall meeting for this month. I would like to start off with a connect to purpose, and so I'm going to read a story of a patient that we had here back in February. In early February, the ICU received a 40-year-old COVID patient being transferred from the 7th floor. On April 5th, the patient had been vented for 2 months, and conversations about alternative treatment plans took place. Unfortunately, there were no alternatives available for this patient, and the patient and her husband began to have difficult conversations. The nurse, Alyssa Spangler, and Dr. Mayo answered all of their questions, and the decision was reached to remove the patient from life support. With her husband, the patient decided to wait until the end of the week to allow her time to say goodbye to her husband, 5 children, and extended family members from out of town. On Tuesday morning, Alyssa suggested we take the patient outside where more family could visit with her. Approval was provided by Dr. Mayo. However, the family was cautioned that this was risky. When the patient got outside, she had the biggest smile. She felt the wind on her face and the sun on her skin for the first time since February. There, the patient got to spend time with and say goodbye to the family she had not seen in months and their family dog. Thank you to Alyssa for always being a fierce patient advocate and having the awareness and ability to connect with your patients and their families. The family requested the patient be comfort measures only on Thursday and requested Alyssa to be the nurse. The patient passed away peacefully, surrounded by her loving family, holding hands as their pastor prayed over her for peace and for peace for them. Although this story, of course, had a very sad ending, it does demonstrate the great work and the impact that you have on our community and how important every interaction that you have with our patients and their family members and with each other helps us to provide high quality care and show our community that we are here for them and that we care. And so thank you, Alyssa, thank you, Dr. Mayo, and thank you the entire team, everyone who was involved in this particular patient's care, because I know respiratory therapy was involved and several other support teammates as well. So thank you all for that. And that's a perfect example of how we can, even in difficult times, make a positive impact on our patients and their families. So with that, I'm going to go and give you a few updates. We have a few organizational updates. Recent accomplishments rather. So I'm going to start with recent accomplishments and highlight the Silver Award for our cardiology care. Kudos to our cardiology team. This is for patients who have come in with heart attack. These are STEMIs and non-STEMIs. And basically the quality of care was significantly better than most hospitals around the country. And so our team was awarded the Silver Award, and we want to congratulate them for great care and service. The second thing is that we had a Joint Commission lab survey. Of course, Patrick and his team did an exceptional job with that survey. And we've got rave reviews from the surveyors who were here. And again, thanks to our lab team, our heroes behind the scene that are making things happen every single day, and great work on that survey. And as we all prepare for the full-blown Joint Commission survey that could be any day now, that's a good example of how we can emulate the work that was done in the lab throughout the entire hospital. Just to give you a quick update on physician recruitment, we have welcomed or will welcome 9 new physicians as well as 7 APPs to our team over the next 2 months. And so we're very happy about that. We don't have all of the providers that we need, but we are moving in that direction. And of course, these 9 physicians and 7 APPs will help us to get closer to our ultimate goal of filling all of those positions and being able to take care of our patients in the right place at the right time. In terms of I've been appointed to the State Health Coordinating Council, and so that gives Goldsboro an opportunity to have a voice at the state level. The Coordinating Council recommends certificate of need decisions, and based upon the data and looking at some of the outcomes and information that's available in the public domain, as well as being reported by individual health organizations and facilities throughout the state. And so that gives us an opportunity to see how other hospitals are doing things and also to have a better understanding of the certificate of need process. So we're very happy to have that opportunity to have input in those decisions, and also to understand how those decisions are made and give Goldsboro a voice at the state level. Finally, I want to recognize our maternity team. Of course, they were recognized in the recent issue of Becker's by the Leapfrog and Newsweek initiative that recognized 217 hospitals across the country. And this is extremely noteworthy from the standpoint that North Carolina had the second highest number of hospitals for any state in the U.S., second only to California. And UNC had 4 of our hospitals that were recognized, in addition to Wayne, for our maternity care. So again, only 217 hospitals from around the country were recognized for their maternity care, and our team was one of them. And so congratulations to them and the awesome care that they're providing to our mothers and babies and families as they welcome new ones to the world. This slide gives us an opportunity to highlight some of the great work that's being done and some of the things that we can share with our members in the community as we talk about the great work that's being provided here. And also as we look forward to ways that we can continuously improve. These are good news stories that we need to share at every opportunity and make sure that we're marketing, if you will, to our community, the great care that's being provided and answering any questions that they may have. So again, kudos to everyone who had input to many of these different accomplishments and recognitions. Next, I'd like to give you a few updates. Our Well2 program, of course, encouraging everyone to get vaccinated, is in full swing. We also want to make sure that we answer any questions that you may have. I know we've done several videos with members of our medical staff from all of our medical specialties just about, and tried to answer as many questions as we could. As we know, and the evidence continuously shows in a significant way that vaccination is one of the best things that we can do to prevent this disease from spreading. So please continue to consider that if you have not, and ask any questions that you may have, and we'll try to answer those as best we can. I want to welcome Mr. Adrian Worrell, who's a new member of our board of directors. He's not new to the community. He's actually a Navy veteran and also the owner of Worrell Contracting. So not I guess a stranger to many of our teammates in the community, but he's joining our board as the latest addition to our team. And so we're very happy to see him join our board of directors. We, of course, have our PTO cash out during this month. So if you're interested in doing that, please talk to your supervisor, reach out to HR, and they'll help you with that process to make sure that you are able to participate in that if you'd like to do so. And please make sure that you're taking your time off as needed to get that work-life balance, because I don't want anyone to lose any of their time off. That's a very valuable resource. And so please take an opportunity to do that and make a decision whether you'd like to cash out or whether you'd like to take your time and so you don't lose any of it. We have a 125th celebration coming up starting on June 1st. This year is our 125th year of serving our community. Our number of events that you'll see on the website that will come out very soon will tell you exactly historically where we've been. If you're new to the community or new to the team as I am, it's very interesting to read the history and see how far we have come and just all of the progress that has been made over the years that has brought us to this point. And of course, the future is going to be even brighter from technological advances to advances in terms of how we provide care and how even teamwork and collaboration. It's just awesome to see all of those advancements. And again, it makes you excited about our future as we continue to move in the direction of improving and continuously focusing on what's best for our patients and community. Finally, I want to remind you of our workforce engagement survey. And actually, these numbers keep changing, which is a good thing. The number has already gone up above 63%, and so we're very happy about that. So please continue to encourage your teammates and to complete the survey. We want to hear everyone's voice. We want everyone's input. We want to make sure that everyone has an opportunity to have their voice heard. So please complete that survey if you've not done so. And if there are any questions, please reach out to your supervisor, reach out to HR, reach out to your vice president. And we're going to try to answer those as quickly as possible, but please consider sharing your voice with us in terms of completing that survey. Okay, next I'm going to shift into our mission, vision, and values. And in the next series of slides, I'm going to talk about our organizational goals, kind of give a quick review from 2021, FY21 rather, and then talk a bit about FY22. But the focus and the foundation for everything that we do in terms of our organizational goals, our strategic plans, and everything else. And our strategic plan, essentially, a part of that strategic plan is what you see before you now, which is our mission, vision, and values. Our mission of being patients first, quality healthcare close to home, vision of being the preferred choice for compassionate, high-quality, patient-centered healthcare. And finally, our values of compassion, respect, quality, teamwork, and integrity. Taking us back to those foundations is essentially what we need to focus on in every one of our organizational goals and every one of our activities during the course of the day. So as I walk through all of these different organizational goals, specifically for FY22, I have some specific comments that will help, I think, make the connection for every one of our teammates about how important each one of these organizational goals and how they tie back to this mission, to our mission, vision, and values. And more importantly, I think it's critical that each and every one of us understand our individual role in how we accomplish these organizational goals and ultimately accomplish our mission of being patients first, quality healthcare close to home. So the first slide is a recap of our FY21 goals and kind of our performance year to date. Again, just a reminder, these are the different metrics. On the left-hand side, we have our baseline, we have our 50% threshold, 70%, and 100%. And then, of course, our year-to-date performance. And then this is the methodology time frame that's used for gathering the data. And then an orientation to tell you which direction we'd like for the metric to move. So the colors are, of course, the clear indicator of where we're doing very well and areas where we may have some opportunity. So clearly, patient experience is an opportunity where we are getting very close, not too far off, but we're getting very close. But we need to continue to focus on that. And as we again look at our mission, respect for our patients and patients' perception of that respect, which is probably a better way to say it, is something that we really have to continuously focus on, because patient perception may not be the clinical and quantitative reality, but that is their perception based upon their understanding. And so we have to make sure we understand that and meet patients and their families, quite frankly, where they happen to be at that time. We also have some opportunity in terms of some of our quality metrics. Again, not significantly far off, very, very close. And so we're moving in that right direction. And as we come out of the fog of war of COVID, we have to go back to the basics and look at those evidence-based practices and focus on those opportunities that we have to improve our quality of care for our family members who are members of our community as well, and our teammates who come to see us. And I think this is a great opportunity, too, for me to thank every member of the team. I was recently a patient here in the hospital, and I want to thank you all for taking such great care of me. My wife was just blown away. I don't know how else to put it. And then when we got the card last night saying thank you for allowing us to take care of you, that was just the icing on the cake. So thanks to the endoscopy team for taking such great care of me. And of course, my wife, again, was blown away. So thank you so much for welcoming us to the community and taking great care of me as a patient. And again, I know that's what we want for every one of our family members and every one of our members of the community that come through our door. So again, please continue to do that, and we'll be able to move this red to blue and to green in no time. So please continue to focus on these metrics as we close out this FY and then continue to focus on moving into FY22. So this is a kind of a slide that goes over all of our FY22 metrics. And again, it may be a little difficult to read, but I'm going to walk through them very quickly by category and then by groups of metrics, so they'll make a bit more sense. But again, I want every member of our team to understand how you as an individual can help to drive these metrics and help us to accomplish our mission for our loved ones, and quite frankly, because that's why we're here. So the first one is looking at reducing our ED and observation length of stay. So if you look at the very bottom, each one of these has what I'd call a question at the bottom. Says, how does this goal help us to make progress towards our mission? And in this particular case, when our hospital is efficient, we improve patient experience and clinical outcomes while reducing costs to the patient, because there is a quantitative cost to many of our patients in terms of their insurance if they're in the hospital longer than they need to be, or if they have a time period that's beyond what should be. Fortunately, our length of stay is moving in the right direction, and we are very, very close, especially on the inpatient side of being where we need to be in terms of length of stay. But we do have some opportunity in these metrics, so please continue to focus on those. And we all have a role in that, helping to move these metrics. The next one is, improving our risk adjustment documentation and coding by developing and implementing an improvement plan. This factors into our mortality index, making sure that the documentation that's in the patient's chart is accurate and truly reflects the patient's condition. It may not be involved in, it may not be a part of the decision-making process for the patient's immediate care, but it is important to document that full picture and provide the context, if you will, for all that is going on with that patient in terms of their comorbidities and other things that may occur, to make sure that documentation is accurate. And again, that significantly drives our mortality index or mortality indices, which is of course up next, the adult mortality index. So that, as I mentioned before, our coding and documentation is significant in terms of impacting that. Several of the others are the opioid prescription standardization, 30-day readmissions, patient falls, which of course is an NDNQI metric and a measure that our nursing team watches very closely, and then our infection composite metrics as well. Many of these quality metrics are also reflected in some of the publicly reported things like Leapfrog, CMS stars. You'll see some of these metrics repeated throughout those metrics as well. And it's important, of course, that we provide high quality care. That's a part of our mission. And in terms of our opportunities to improve our overall mortality, safety, and readmission rate, these are some of the metrics that we're driving, and the action plans behind them in each one of our individual roles are important to help us to drive quality and improve towards our maximum goals. As you see on the far right side, that's what we're trying to achieve in terms of our maximum performance on those goals. And just to give you one quick example of the infection measures, of course, I'm an administrator. I have no clinical training whatsoever and not licensed to do anything. But I can still help with that infection measure as I round on the floors, as I shadow our great nurses. I've shadowed nurses on the 4th floor, I think, and in the ED as well. And so making sure that I use proper hand hygiene before I encounter any patient or family member or any of our teammates at every opportunity. That will help to ensure that we don't have unnecessary or avoidable infections in our hospital. And that's something that we can all do. So there are things like that, and each one of these metrics, again, think about what you can possibly do and what you can possibly contribute and what information that you can provide and support that you can provide for our team to help to move the metrics on these the needle on these metrics rather. Okay, so the next, this is a system goal: redesign care to improve patient care outcomes and reduce unwarranted variation and cost. These are our clinical pathways, our navigators, and all of those different evidence-based tools that we have in terms of following best practice. Some of our nurse-driven protocols even fall into this category, ensuring that we are consistent and reduce that variation to produce those significant outcomes that the evidence has consistently and statistically significantly shown us will produce better outcomes. We just need to adhere to those. And so please continue to focus on that. Here are some examples and of the pathways that we have here, 1 through 6, you'll see here, but there are others that are helping to drive this. But of course, we're focusing on these, and the maximum will be to get 4 of the 6. But of course, we want to shoot for all of them if we possibly can. So in every way that we can, let's focus on evidence-based practice and ensure that we're focused on quality. These are, again, our patient experience scores, just like at FY21. Many of them are the same metrics, but we did make some adjustments and some slight tweaks to these. But many of our patients make their perceptions or develop their perceptions about the quality of care based upon their patient experience scores. And so they may not have the knowledge, like I don't have the knowledge to appropriately assess clinical quality, but I have a perception based upon how you interact with me, how you answer my questions, how you answer the questions for my family members. And again, I just have to give you a perfect example of my experience last Friday rather. And again, my wife was just totally blown away. When we first walked in, the first thing she said was, "This is much nicer than what we had in our previous hospital," as we've had to go through the same process. And so again, we've got the right elements here and we've got the right tools. We just have to improve our consistency and make sure it's every patient, every family member, every time, and we'll get there. So our next metric is also a system goal, which is to grow the pipeline of digital and virtual health services, and this might be called digital health in terms of how we're providing those different services. We've got several of them that are in the queue right now that we're working on, and we're going to probably have a lot more in the future. But this is an opportunity for us to leverage many of the specialties that you'll find in higher acuity hospitals and tertiary facilities that are not commonly found in community hospitals, but we had that access through a telemedicine link to UNC hospitals that do have those services. And as we continue to grow as an integrated system, This is a huge opportunity for us to leverage those specialties when appropriate, to be able to give our patients access to care, and which again is a part of our mission, close to home, means they don't have to travel. So the next goal is to establish a process to recruit and track progress of our Campbell students in returning to the organization. As I mentioned earlier in the presentation, we are recruiting we're continuing to recruit physicians and APPs, and we have 9 physicians and 7 APPs coming on board very shortly. And so we want to make sure we continue that pipeline of ensuring that we have all of the providers that we need in the community, and all of our support team as well, to be able to take care of our patients in the appropriate way, so they don't have to travel, again, close to home. The next one is to increase our recruitment of Wayne Community College nursing scholarship graduates. And I believe in this last round of students, every one of the students who receive scholarships from us will come to work for us at this point. And so we're very happy about that. We need to continue that trend and make sure we're getting the best of the best, if you will, and continue to recruit nurses, not just from Wayne Community College, which of course is a huge partner of ours. And this is the most connected program I've ever seen in my entire career. So that's a great opportunity for us to leverage our neighbor right down the street in terms of our opportunity to fill our ranks and ensure that we fill all of our nursing positions with highly qualified nurses, and help our nursing team that has been so battered over the past months during COVID especially. So. Okay, participate in One UNC Health coworker experience. And of course, we want to promote and improve wellness and connection across UNC Health. As we align as a healthcare system under the One UNC Health framework, our teammates will have the opportunity to learn more about the values and long-term priorities and the significant benefits of an integrated system. I mentioned several of them previously, but this is a huge, again, opportunity for us to leverage our partnership with UNC and all of our hospitals. Some of them are owned and some of them are managed, and you get to see a significantly different perspective from systems that have all of their entities being owned. We have some leverage and some latitude. You'll find that the old saying that all healthcare is local. We have that latitude to be able to adjust some of the things that we're doing to make sure that it's most appropriate for our community, as many of the other hospital leadership teams that are managed as well. So this is a huge opportunity for us that we'll continue to leverage going forward. The next one is to create a diverse, equitable, and inclusive culture. And a diverse and equitable and inclusive culture is key to achieving health equity for our patients and improving the health and well-being of our patients and overall community. These goals will help us to recruit, build, and retain a diverse workforce. We want to make sure that we're representative of the patients that are coming to see us and their family members, because that makes them feel welcomed, quite frankly. When you go someplace and you see people that are welcoming and that are inviting and that are understanding and that are compassionate to your plight and understand the particular situation in which you may be struggling, it gives us all a sense of comfort and a sense of again, of caring and compassion. So that's something we really have to continue to focus on, and look at those that are different than us, and try to better understand those that are different than we are, and don't, those different perspectives from which we may not have been raised and may not have any historical background or context. It's important that we remain curious and that we always try to find out how we can better connect with not just our patients and community, but with our teammates as well. And with our physicians and providers. So what can you do? Put quality, safety, and service to our patients first. That should be top of mind in everything that we do. As I've said to many of you before, there's 2 things that I ask that everyone in our hospital, and I ask this of our medical staff, our physicians and APPs as well. Please wash your hands. Continue to wash your hands. The second thing is treat everyone that you encounter as if you would treat the most treasured member of your family, or the most treasured person in your life. If you treat everyone that you encounter that way, you can't go wrong. Be they teammates, patients, or community members, you can't go wrong. So please continue to remember that. Support the need for change. Change can be difficult, especially if we've done something a particular way our entire lives. Just think about our changes at home when things change, and it's very uncomfortable and sometimes it's unnerving. But please continue to support that change and actively participate when you're asked, because that's also helpful. We want to hear your input, just like the West survey. We want to hear your feedback, and we want you to be a part of what we're doing, because if we don't hear from you, we may make a mistake, and we want to make sure that we hear your input and hear those best practices And make sure that what we're thinking about will actually work in terms of the implementation, because you're doing the work every day. So please make sure you give us that feedback. Seek understanding when needed. If you don't understand something, please ask the question. As I mentioned, I've shadowed some of our nurses. I've shadowed some of our other teammates as well. And during those time periods, I always ask, what questions do you have about anything? If I don't have the answer, I'll come back and talk to the experts like Donna, Dr. Filippo, Howard, Bill, and Allison, our vice presidents who are experts in their field. I'll get the information from them if I don't have the answer, but please continue to ask those questions of your leaders, ask those questions of each other, and continue to seek to understand and keep that inquisitive perspective and inquisitive focus. And ask your management team about any questions again. Just reiterating that, because there are no dumb questions. There are no questions that are inappropriate in terms of how we can better take care of our patients and how we can better take care of each other and work better as a team. So please continue to do that and focus on trying to focus on our mission and all of those goals and objectives that I mentioned before. So with that, I'm going to stop my sharing of the slides. And again, I want to thank you all for what you're doing on behalf of the senior executive team. I want to thank you for everything that you've done over the past year. I know it's been a difficult year and it's been a very difficult time. So please continue to stay safe. Consider vaccination if you have not done so. And please reach out to us if you have any questions. Please stay safe and take care of yourselves and your loved ones. Have a great day.